Hi there, welcome to cardiology. My name is Dr. Diamond. I'm going to be taking care of you today, alright? Basically, why you're here is we need to run a few tests, see how your heart is acting. We need to monitor it for a little while. You could have normal heart rate, you can have tachycardia, which is a abnormal fast heart rate, or bradycardia, which is a slow heart rate. And both of these, tachycardia and bradycardia, both happen while we are at rest. So if your heart is beating faster than normal while at rest, we need to know. Or if it is beating slower than regular while at rest, we also need to know, okay? Basically, what we're going to do is first I will take my stethoscope here, and I'm just going to be listening. I'll listen to your breathing. I will listen to your heart rate from your chest, your back, wherever I need to listen. I will do my analysis, what I think that we should do next, and then we'll go ahead and do whatever I think needs to be done. I won't know exactly until I listen, but there's nothing to be afraid of. Don't worry, because a lot of the times when we do our test, we can figure out exactly if there is a problem, because you may be perfectly fine. But if there is a problem, we can do a test to figure out what it is, and then we can treat it from there, okay? So, if you're feeling okay, you're not deathly ill or anything like that, then you should have nothing to worry about. If there is a problem, I guarantee we should be able to find a solution together, alright? What I need to do is just ask you a few questions, and I'm just going to jot them down. It's kind of just a little analysis before I go ahead and listen. Is that okay? Alright. So, would you please just confirm your last name and your date of birth for me? Perfect. And you are aware that you're at the cardiologist, correct? Which is the heart doctor. If you don't know, cardiologist is the heart specialist. Okay. Are you having any pain today? Any chest pain, discomfort? Okay. Very good. A few more questions here. Have you consumed any caffeine today? Okay. How much caffeine do you consume on a regular basis? Just an educated guess, you don't have to be exact. Perfect. Very good. Do you consume a lot of water on a daily basis? Okay. And let's see, do you happen to have any panic disorders or anxiety disorders that you are aware of? Okay, thank you. Do you know if you have low blood sugar, or if you've been tested for low blood sugar? Okay. Do you chronically suffer from any dehydration? So on a daily basis, do you feel dehydrated? Do you know if you have ever been dehydrated severely? Or do you just kind of feel thirsty? Okay. Do you have any phobias that you are aware of? So this is a very emphasized fear of something if you're unaware. So some people have a phobia of snakes, spiders, heights. Okay. Do you suffer from night terrors? And my last question is, do you suffer from alcoholism? Alright. Let me just go ahead and make sure. Okay, you look good. So here's what I'm going to do. At first, I'm just going to be listening with my stethoscope, okay? Just on your chest and everything. What I'm mainly looking for is arterial fibrillation. This is an irregular heartbeat. It is a little bit easier to find on like an EKG monitor, which we probably will hook you up to based on my analysis here. But I'm going to be listening closer to the upper chambers of your heart, see if I hear anything, okay? And then we're just gonna go from there just based on my analysis. So first, I just want you to relax. Don't take any deep breaths that are too abnormal, you know, you don't have to do that, that's okay. Just your normal. I'm just gonna ask you to breathe normal for now. I don't want you to raise your heart rate for any inconsistent breathing or anything like that. I just want to listen to you while you are at rest for now. So, what I'm going to do, don't want that to be too cold for you, and I'm just going to listen, okay? So like I said, just your regular heartbeat, just breathe normal. In through your nose, out through your mouth. Good. You're doing great. Good. Okay, now what I'm going to ask you to do is I'm going to listen. I just want you to go as big as you can in through your nose, okay? Ready? Go ahead. And blow that out. Alright, good. So what I'm going to do now is just place this on your back here, and I'm just listening. So just relax and just let me listen. What I'm going to do is just going to schedule a test for you. Alright, don't be concerned. It's totally fine. Let me write this down. I am going to have a monitor on you, so we're going to put a few electrodes on your chest. I'm just going to monitor your heart. I'm not sure if I hear what I would call an irregular heartbeat, but I just want to be sure. I just want you to be happy, healthy, and taken care of. So I will just schedule this to be done here. Do you have some time? We can do it right now. Okay, perfect. Alright. I'll show you what it is. We're going to be putting a few of these things. They're called electrodes. We are going to be sticking them on you. Before we do that, well actually I'm going to be the one doing it. I'm going to take my gauze here and just, excuse me, I will be wetting that down with some alcohol. I'll wipe the area. All of the areas that I will need to be free to stick on the electrode, we'll wipe down with some alcohol. You won't feel any discomfort. This is not a painful test, anything like that. Nothing's going to be sticking in you. It's going to be sitting on top of your skin, so don't worry about that. And I'm just going to be putting this on, like I said, just how I explained, and then we'll go ahead and monitor, see how you're doing, alright? Alright, so first what I'm going to do, once I have your electrodes on, I'm going to go ahead and listen with my stethoscope again, and just see how we're doing. So first, let me go ahead and put my gloves on. These are not latex, by the way, just in case you were to have an allergy. They're not latex. Okay, keep my hair out of my face. So what I'm going to be doing first is opening our electrodes. There should be 5 in here. And let me go ahead and count 1, 2, 3, 4, 5. I will show you what it looks like. So here is what they look like. This part will stick to you, and the other part we will have hooked up to a radioactive wave. Alright, so you won't see that. We won't have to put a bunch of wires on you. It's just going to be electronically sent for a signal. So what I'm going to do is clean 5 small spots on your chest with my gauze sponge. And this is all this is. There is quite a few here. Let's say 4, maybe 5. Oops. We can't use that one now. Broke the sterile field. So I'll just be using this one. Put that off to the side. So I will be getting the alcohol, the rubbing alcohol on that. So if you would please just remove your shirt for me, and I will get this set up. As you can tell, this is now nice and wet, and so are my gloves, so let me just wipe those off over here on my cloth. That's okay if it's a little bit damp, nothing to worry about. Okay, so what I'm going to do is just rub this on the areas where I'm going to be sticking the electrodes, okay? So just relax. Almost touched my face there. Just relax. I'm just going to be wiping a few spots on your body here. You're doing great. Are you okay? It's not burning or anything like that? Perfect. That's what we want. We don't want it to be burning. And then one spot over here. Now, I'm just going to fan those with my glove, let them dry a tiny bit here, just so the electrodes stick. Okay. Now, I'm going to place our garbage back in this little bag. So, the cloth that we dropped is still over here because I'm not going to touch that and contaminate my gloves. So this is our rubbing alcohol cloth, and we will just put that in there. As you can tell, it's getting the paper wet. These are woven gauze sponges. Couldn't think of what it was called. Alright, so let me go ahead and put my cap back on this. And now, I'm going to reach into one of these, alright, and I'm just going to pull one out, okay, this is what they look like. This is what's going to send the signal electronically up to our nurse's desk, okay, to monitor. So, what I'm going to do is peel off this back part. So this is where it peels, is right here. I'm going to peel that off. Just stick that on your chest, okay? Again, you will not feel any discomfort. It's not supposed to be uncomfortable. So, here we go. I'm going to peel off the first one. And you can take a look at that. what I'm going to do is just place it right here on your chest. Good. Perfect. I'm just going to rub that real good and make sure that it sticks. Good. Okay. How does that feel? It's not uncomfortable or anything? Perfect. That's exactly what I want to hear. I'm going to show you the inside here. There's 4 more. So I'm just going to reach in and pull out another one. And I'll do this one slightly further down on your chest. Here we go. Okay, I'm going to place this one right here, okay? Oh, wants to stick to my glove. Alright, good. And just rubbing that one as well into the skin. Are you doing okay? Alright, good. There we go. Okay. I'm getting another one here. And I'm going to peel that. We have one there, one there. I'm going to put one right here, okay? So a little bit further on your chest. Here we go. Okay, throw that away. And here we go, right here, alright? Oh, it's sticking to my glove. Good, alright, and then just rubbing that one into your skin as well. Okay, excuse me while I wipe my face with the side of my hand, not my fingertips. Alright, there we go. Now, you should have 2 more. Yep. Take a look. 2 more. Alright. This one I'm going to be placing slightly further down than the last one. So let's go ahead and do that. We go. So right down here. Stick in my glove. Alright, there we go. Good. Just rubbing that one in. Perfect. And now this last one we're going to do up right there, okay? So a little bit further up on your shoulder. This is now empty. Alright, so here we go. Alright, and this one's going right up here on your shoulder. Okay. Good, and just, again, rubbing that in. You just want to make sure that they stay on nice and tight. You don't want them to fall off or anything. So, now just sit tight. Let me press the button here for that to start. Alright. And there we go. So that is going to start sending the signal as of right now to the front desk where the nurses are. What I'm going to do is clean up this garbage. Put all the little pieces in this little bag here. How do you feel? Are you okay? Alright, good. Now, just let us know if you need anything. There will be a nurse soon to come in and take care of you. And then I'll be back in a few hours. I have a couple other patients who need the same thing that you're getting right now. But what I want to do is just listen to your heart rate really quick again with my stethoscope. And then I will let the nurses take care of you. Now, if you need a water, if you need a little snack, anything like that, they will be more than happy to get it for you. So here's what I'm going to do. Just take this and go ahead and set it on your chest, away from these electrodes that are on you. And I'm just gonna listen again, so just sit normal, okay? Good. Good. Okay. All right. So you sound perfect. As of right now, everything sounds really good. So we will be monitoring your heart rate with these electrodes here. Like I said, the nurses will be watching every second to make sure everything's okay. I don't foresee any issues. I really don't think that you're gonna have any problem or anything like that. So I will be back to take care of you. In a few hours, I'll be back to see what's going on, check your results and everything, and then you'll be able to go home, okay? As long as everything is good. Alright, well, you take care. It was a pleasure getting you all set up, and I'll see you in a few hours. Alright, bye-bye. Try to relax.